Hey guys, Christine here with Storehouse Insurance Services, here to answer your health insurance questions today. The question I'm going to answer today is, and I get this sometimes, is dental insurance worth it? And I always have to say that depends. It depends on what your needs are. And each person is different. There are times when people come to me and they have a lot of work that needs to be done. And in that case, I usually recommend a dental HMO. And the reason for that is, now there's a difference with regards to dental insurance. You have your HMOs and your PPOs. And some of the differences between those are, with HMOs, there's usually no waiting periods, and it's pretty low copays, and they're set copays. It's never co-insurance, so you always know exactly what the dentist is going to charge. Now, with HMOs, probably the biggest drawback to them is that you're usually very limited on your providers. So you can't just go to any dentist, and they typically are not contracted with a lot of HMOs. So that probably is the one drawback. They're very well priced, and they can be a great option for someone who needs an extensive amount of dental work done right away. Another big thing about HMOs is that there's no waiting periods, and that's a really great thing. Now, PPOs, the way those work are typically they're a little bit higher priced, but usually not too much. You have a much wider selection of dentists that you can see. And there's some PPOs that will allow you to see any dentist, which is nice. However, there are some caveats with the coverage. Usually it's co-insurance, and so that means that it's going to be a percentage. So it can be a little more difficult to predict what your costs are going to be with an individual PPO dental plan. Also, another thing that's important to be conscious and aware of is that your PPOs always have a calendar year maximum. That means that the insurance carrier is not going to pay out more than a certain dollar amount each year. Generally, the average calendar year maximum is around $1,000. Now again, with HMOs, there is not a calendar year maximum at all. It's unlimited. So again, it all depends on what your needs are, guys, with regards to dental insurance. So typically with a PPO, the best fit for those are people who maybe they get a filling once in a while and they want to get their teeth cleaned at a zero cost twice a year. Hope this has been helpful, guys. Feel free to check out the other videos on this site answering your health insurance questions and your healthcare reform questions. And I encourage you to visit my website or click on the link below to set up a time to talk with me. If you have specific questions or you would like some guidance navigating these new waters that we know as health insurance, set up a time to talk with me. You can set up a 10-minute phone call with me on my calendar at the link below. Thanks, guys. Have a great day, and thanks for watching. Bye-bye.